Okay, so guys, let's start with the brainstem here. So we'll be discussing the brainstem in two views. First, we'll see the brainstem from the front, and then we'll look at the brainstem from the dorsal aspect. When we see the brainstem from the front, we'll be discussing how exactly the cranial nerves are coming out, the different level of the cranial nerve exit. It's a very common question to get that they point out a certain cranial nerve and they'll ask you that, okay, what is the function of this nerve? What muscle does it supply? Injury to this nerve will lead to what? Basically, it all comes down to identification of the nerve. So in this picture, in the ventral aspect of the brainstem here, first and the foremost, see this space here, the space between the two cerebral peduncle here is called as interpeduncular fossa. That fossa over there is called as interpeduncular fossa. Right, so that's a fossa called as interpeduncular fossa. And this interpeduncular fossa is bounded by the two peduncles. You can see these are the peduncles here. This here is a cerebral peduncle here. If I just this here is the peduncle, the cerebral peduncle. It's a part of midbrain. So the fossa is between these peduncles only. That's why we call it the interpeduncular fossa. And anterolaterally, you can see optic chiasma and optic tract is forming the boundary here. So that obviously is the optic chiasma, and here is the optic tract. So optic chiasma, optic tract, and the cerebral peduncle, these are the forming boundaries of the interpeduncular fossa. The contents in the interpeduncular fossa, now we'll come back to the content here. Let's just go through the nerves in first. This here obviously is the olfactory tract that to be seen here. That's the olfactory tract. That's the first nerve. This is optic nerve without a doubt. That's an optic nerve. The only nerve that you see present in the interpeduncular fossa, guys, the only nerve in the interpeduncular fossa is the third nerve. That's the only nerve in the interpeduncular fossa. And then from the dorsal aspect of the brainstem, the only nerve emerging from the dorsal aspect of brainstem is the fourth nerve. Trochlear is the only nerve coming from the dorsal aspect of brainstem. Also remember, this is the most slender nerve also. You can identify this nerve based on its thickness. It's a thinnest cranial nerve out of all. That's a fourth nerve, and it is the only nerve. It is the only nerve from dorsal aspect of brainstem. It's the only nerve from the dorsal aspect. Then when you come to this, the part, this here is pons, of course, guys. This is the pons region, right? You can see the basilar sulcus also on the pons here. Now there are many nuclei present inside the pons, but that doesn't mean the nerve will also come out from there. The fifth nerve, the trigeminal nerve, is coming out of the ventral aspect of pons, but actually it is coming out from the very much lateral part of the pons where we have middle peduncle, middle cerebral peduncle is there. So this whole thing is the thickest cranial nerve, and that's the fifth nerve. And that is the only nerve that you see which is emerging from the ventral aspect of the pons. Otherwise, from the pons, you will not see any nerve coming out here. The remaining nerve coming out from the pontomedullary junction. But from the pons, only fifth nerve can be seen emerging out from the ventral aspect. Then when you look at this junction here, guys, this junction here is pontomedullary junction. Now on this pontomedullary junction, there are three nerves present here. This is the sixth nerve, abducens nerve. This here is the seventh nerve. And that is the eighth nerve. Sixth, seventh, and eighth. Sixth, seventh, and eighth. Now these three nerves are coming out from what junction? Pontomedullary junction. See, it's very important to know the exit of these nerves because that will also help you in the transverse sections also. When you take a transverse section of pons from the lower part, you may see these three nerves. So it's not only about answering the question from the ventral aspect of brainstem. Understanding some transverse section is also to be done based on this. So 6th, 7th and 8th nerve, they are coming from pontomedullary junction. You can see there are two parts of 7th nerve also, if you can see carefully, guys. The thicker part is motor, thinner part is sensory. And 8th anyways is having two parts, the vestibulocochlear. Then when you look at medulla oblongata, guys, in the medulla oblongata, this midline elevation here is called as pyramid. The pyramid is because of the pyramidal tract. Undecussated fiber goes till the lower medulla oblongata and that forms the pyramid. And just lateral to pyramid, there is another elevation which I am highlighting only on one side. Now this elevation lateral to pyramid is called as olive. This lateral to pyramid, this here is olive. Olive is because of a nucleus called as the inferior olivary nucleus, guys. So inferior olivary nucleus forms this olive. Let me just mark on this side as well. This is olive. So there are three nerves that you're looking at which are emerging lateral to olive. Lateral, first we're talking about. So we have ninth nerve, 10th nerve, and 11th nerve. Now we got this ninth nerve here. We got this 10th nerve here. The multiple rootlets of 10th nerve coming out here. Multiple rootlets of 10th nerve. And then 11th nerve. Both these are 11th only. The cranial accessory and spinal accessory, that's 11th. So 9, 10, and 11, I can say 9, 10, 11, these three nerves are emerging from lateral to olive. These three nerves are emerging lateral to olive, that is 9, 10th, and 11th. And the only nerve which comes out between pyramid and olive are the rootlets of hypoglossal nerve, the 12th nerve. If you go further, obviously you'll see the C1, C2, C3 nerve coming out from the same sulcus. But when you look at in between the pyramid and olive, the only nerve that is emerging between pyramid and olive is the hypoglossal nerve. So it is a nerve which is between pyramid and olive. It is present between the pyramid and the olive here. So guys, that's the first thing to know about, that how the cranial nerves are coming out from the different part of the ventral aspect of brainstem. Only fourth nerve is coming out from the dorsal aspect, which we will see in the next section. Otherwise, rest of the nerves you need to identify based on these certain hints here. Like, I'm pretty sure that first and second nerve is not a confusion for anyone. In the interpeduncular fossa, only one nerve, that is a third nerve. From the dorsal aspect of brainstem, the thinnest cranial nerve, that is the fourth nerve. Then when you look at the pons, now there is no nerve that you will see on the ventral aspect of the pons, only on the lateral side, very much on the lateral side of the pons, where the middle cerebral peduncle is present. So from that region of the middle cerebral peduncle, from the ventral aspect, the fifth nerve, the thickest cranial nerve will come out. 6, 7 and 8 at pontomedullary junction. 6, 7 and 8 pontomedullary junction. 9, 10, 11 are lateral to olive. And the only nerve between pyramid and olive is the 12th nerve. The hypoglossal nerve is only nerve between pyramid and olive. Now what else you will see in the interpeduncular fossa, because this will be really helpful in the later part of this discussion here. If you look at this interpeduncular fossa, guys, there are some contents which are inside. Now let me just give them numbers here so that we can write them separately. One of the content of interpeduncular fossa, which I'm giving it number 1, is the infundibulum of pituitary. That's a stalk of pituitary here, which is coming from this elevation, and this elevation is called as a tuber cinereum. That elevation from where the stalk is extending is called as a tuber cinereum. So infundibulum and tuber cinereum is there. The second content, which I gave it number 2 here, this is mammillary bodies. That's the second. It's a component of the limbic system only, where the fornix fiber will end. That's a mammillary body. Number 3 is a third nerve itself. You can see the third nerve, we already said it is coming out of the interpeduncular fossa. And number 4, you can see some perforations there. Now that is a posterior perforating substance. So these are the 4 contents of the interpeduncular fossa. So I write interpeduncular fossa hidden. Let me write the contents of interpeduncular fossa here only. The 4 contents, which I mark them as 1, 2, 3 and 4. One is infundibulum. Infundibulum, and that elevation from where the infundibulum is coming is tuber cinereum. That is tuber cinereum. Number 2 is mammillary bodies. These are mammillary bodies. It's a part of the limbic system. It's a component of limbic system only. It forms a part of Papez circuit as well. Number 3, guys, third nerve, oculomotor nerve. Of course, oculomotor nerve is the content of interpeduncular fossa, and then there are some perforations to be seen here, and these perforations are called as a posterior perforating substance. That's a posterior perforating substance. Posterior perforating substance. Actually, the reason for calling it posterior perforating substance, because the branches of posterior cerebral artery will pierce it. This is the area, that's a gray matter area, which is actually perforated by the. This area is perforated by the branches. By the branches of what artery? By the branches of posterior cerebral artery, guys. This area is perforated by the branches of posterior cerebral artery. See, we all know basilar artery will be here in this basilar sulcus, and once the basilar artery divides into posterior cerebral artery, that posterior cerebral artery will give off some perforating branches which will go and supply the core of the midbrain. Now obviously, to reach the core of the midbrain, you have to perforate and go inside, and that's what the perforating substance is all about. So these all are the contents of interpeduncular fossa, infundibulum and tuber cinereum, the mammillary bodies, oculomotor nerve, and the posterior perforating substance. Now, when you say the word posterior perforating substance, guys, there is an anterior perforating substance is also there. Anterior perforating substance is not in the interpeduncular fossa, it is outside the interpeduncular fossa. Now look at this area here, you can see some perforations here also, guys. And that is the anterior perforating substance. That is anterior perforating substance. The important thing is anterior perforating substance is also perforated by some blood vessels, but this time the artery which are perforating it is anterior cerebral artery, and not only that, even middle cerebral artery here. So remember, posterior perforating substance is perforated by the branches of only PCA. It was perforated by the branches of only posterior cerebral artery, whereas anterior perforating substance is perforated by the branches of anterior cerebral as well as middle cerebral. Internal carotid artery will give off both anterior cerebral and middle cerebral. They both are starting at this point only. So they both will give the perforating branches in this region. So this is a little bit about the ventral aspect of the brainstem.